Dating family life. So we're here at Day TV and Fundamentally Mindful. We're here today with Dr. Andrew Saffer. How you doing today, big guy?
Great, thanks for coming.
Good, thanks for having us. So we're gonna get right into it. Being a Charleston native, we have a lot of things in common, which is Coach Cress. I work out at the Jewish Community Center, where I met your sister there. And so you had a lot of time with Coach Cress and come out in basketball. But our main reason why we're here is to talk about the service that you do, and talk about how that relates to our modern day athletes and injury that they're going through. But first, let's talk about the young Andrew Saffer coming up in the Charleston area in playing sports. Just talk about that. Take us to memory lane.
Well, I definitely grew up here in Charleston. My father was very athletic, got me into a lot of sports growing up, and kind of a shy kid growing up. And my dad wanted me to go to the College Charleston basketball camp at the Jewish Community Center, and I was definitely reluctant at first, but I went and had a great time. I was first introduced to Coach Cress. He had that New York accent that we're not used to with all the southern people here in Charleston, and have the influx of all the people from all over the country. And he just had such a passion for the game. It was just kind of exuded out of himself, and really stressed the fundamentals and hard work, and just really made me very passionate about the game.
Right.
I think you may have mentioned something about me just being a hard worker, or some little small comment that my dad told me, and I think from that point really just got me so into basketball.
Nice.
So I pretty much went to every camp every year down to the College of Charleston. Just remembered all the drills that he taught us, the fundamentals, the hard work, and just really followed all the teams growing up. Just all the great teams they had when they won the NAIA championship with Steve Yetman and Greg Mack and all the great players, and this is really good memories for me growing up.
Nice. And so you did attend the College Charleston, and you did majored in
pre-med. Yes,
pre-med.
I did. I played a little bit of high school basketball and tennis, but wasn't able to get to the next level. But majored in pre-med. I wasn't sure where I wanted to go with medicine, and realized that I had foot injuries my whole life. Flat feet. I went to a local podiatrist here in town, Dr. Kalinsky, helped me a lot, and I figured out that we can do some sports medicine with podiatry, and really got focused. So my grades really improved at College Charleston my junior year. Got focused, knew what I wanted to do with sports medicine and podiatry, and got accepted to school in Ohio for 4 years.
And I kind of bring us right back to the same thing we're talking about, because then here you're a young student athlete, had foot problems, and you went to go and get it checked out. And we also spoke to Aaron Thornton today, who had the same problem that came in and seen you. Talk about that. Talk about how that came about, how you wanted to really focus on the foot injury and give some type of expertise back to something that you experienced.
I always tell my patients I know what they go through. I have flat feet. When I was 10 years old, I had orthotics made, really helped me, but I had a lot of foot injuries growing up. It was very frustrating, but I can really sympathize with a lot of my patients, not only athletes, but diabetic patients, people that are just everyday athletes or runners. And so I think it gives me a really good perspective. I think giving back, I really enjoy treating patients like Aaron. It's enjoyable to really treat him very simply with the custom orthotics and make him better pretty quickly to get back to soccer and basketball. So it just really means a lot to me, and makes me very passionate for what I do. Nice.
And something that you focus on and talk about is the heel, and it's a common injury in youth sports. I won't attempt to try to name it, but can you tell the community about that injury and how you help to better athletes when that comes
Yeah,
about?
I think it's very important to know that anytime a patient has heel pain, or you talk to your friends and complain about heel pain, it's not always the classic plantar fasciitis, which you may have heard about. It's a ligament issue on the bottom. Very important to get evaluated for it. It could be a nerve injury, it could be a stress fracture, it could be a growth plate injury like Aaron has. And I think the key is really the correct diagnosis. And in our office, we have digital x-ray and ultrasound, and really able to evaluate patients in the office and just make them better. And so I think that's really key to get the correct diagnosis. And it's definitely, without a doubt, our most common diagnosis we see.
But you do stress to get it done early.
Without a doubt. We do have some patients that do self-treatment at home, which is fine, but if it doesn't get better in a week to 2 weeks, it's not really normal to have foot pain. So if you have a stress fracture and you're walking on that stress fracture and you think it's plantar fasciitis, it could go on to surgery. So I think catching it early is really the battle. If we
Right.
can get it treated early, that can really help and make you recover faster.
And I think that's something that Aaron talked about because he said he thought it was just a little bruise at
Right,
first.
exactly.
And he kept pushing it off, putting it off, and then it, kind of crunch time when he had to get it taken care of. But the season was coming up.
Right.
So athletes really need to, take heed to your body and go get those things checked out as much as possible. As we met, earlier, Dr. Saffer, and Day Foundation just brought you on board as one of our sponsors. Talk about, why you choose to, be a part of the Gus Macker of Charleston and Day Foundation and help us out with, our whole thing with the oatmeal recipe approach.
Okay. Well, I didn't really know much about the oatmeal recipe until we met and spoke about it, and I really think it translates into all professions, any profession you're really in. I think you need all three components. If you're just doing one, it's not going to work. And I know you mentioned the first is education. And I think for your viewers, and young people, it's really finding a passion that you love and finding a mentor, maybe spend a day with a lawyer, doctor, or a real estate agent, and just see what they do during the day. And I think once you find that passion, just try to get the highest education you can, get that degree. And I think that's very important. And also experience. For me, I was able to, in residency, go to the Cleveland Cavaliers podiatrist and work with him.
Nice.
Unfortunately, LeBron James wasn't there at the time. He was in Akron, couldn't get any tickets because he was such a great athlete back then. But I was able to spend time with him, see him interact with athletes, pro athletes, basketball at the stadium, as well as go to his office and see the patients that he saw. Not only athletes, but diabetics, pediatric children, and seeing how they help people. And that's what I really love, is just making people better.
Right. And due to all the experience and training, and that what we call the education part of it, you develop the skill, right? So talk about the skill and then the important of nutrition that goes along with not only Dr. Saffer's everyday life, but your approach to carrying out a tremendous craft that you do.
Well, without skill development, I think it goes hand in hand with education. I think trying to keep on improving yourself. Skill development for me after podiatry school was just going to residency, trying to get the best training I could for foot and ankle surgery. And from there, never being complacent, always trying to learn more. There's always somebody better than you, like in basketball, such as in my profession as well. So I just try to get training as much as I can at seminars and just try to get better at facets of my career to help my patients. Social media is something that I never was trained on, but now we use Facebook and Twitter and blogs to really educate our patients. So I think it's an evolution, just trying to reinvent yourself and never be complacent.
Nice.
And then going into nutrition, I have two daughters, one that's 5, one that's 5 months, so I'm definitely tired in the morning, but I can't do anything about that right now. But I think nutrition is definitely key. I know we talked about oatmeal. I've actually tried to eat healthier in the morning, stay away from the carbohydrates. It does give you more energy, and I really try to set a good example for my patients. I try to keep active and exercise. I feel better about myself. I think I set a better example for my patients. Makes my mind clearer. And just, I think eating healthy and exercising is really the key. And so I think nutrition is very important. And I just think all three really need to be worked together to be, to have a full career in whatever you do.